Hey, Jose. Hey,
Hey,
Edgar.
can you hear me?
Yeah, it seems like there's a little bit of a delay from our voice to the actual like image. You're on mute right now, Edgar.
That's probably why I'm delayed.
There you go. Now it
I
looks good.
said yours, you sound and it matches your video, so
Okay,
you're
good.
good on my end.
Okay, so it might be me then.
No, you look good too. It was
Yeah.
just initial. It was just that initial few seconds.
Okay, so the video and audio, they're lining up?
Yeah, they're lining up.
Okay. On my side, it's not, so but I guess if
Okay.
as long as you can hear me and the video is fine on your side.
Oh, wow. Okay. So like our voice doesn't match the video.
No, not for me.
Oh, wow. Okay. So like you see me moving and then you hear my voice like a couple seconds later.
Yes.
That's what I experienced first. Yeah, I'm seeing that now with my computer as well. So I guess that's just the way it's going to be. Maybe I should log out. No, I think it's just the way it's going to be.
I'm gonna make a quick dash to see if I can get maybe like on an iPad or something. See how that looks.
Okay.
I'll be right back.
Okay.
I'm gonna do this, but I'll be right back.
Okay.
Richard?
So Edgar accidentally reset his computer.
Oh,
So,
dang.
so he'll be back on. Yeah.
How's that? Is that yeah, your video is better on this one. Got you on an
Okay,
iPad.
good.
Yeah. Yeah, okay, that
Okay, good.
I just need to level this. Yeah, and we tested it out this morning and it was fine. I think because we have more staffing now.
Oh yeah, so the bandwidth is getting challenged.
Yeah.
Can you hear me?
Yes.
All right, you're still my headphones. Can you say something?
My name is Richard Raya.
Got you.
Yeah,
got you.
I'm the Chief Strategy Officer.
Nice to meet you, Richard.
All right.
I accidentally turned off my monitor and my whole computer just went haywire. So it shut me out. I'm not even going to touch the monitor anymore. But that's why we practice. And
That's right.
Come in early.
Hi.
Andrea.
Nice to see you all.
Yes, good to see you.
So we've been experiencing in the other workshops that as people come in, they may have their cameras and their mics on. So just ask them to go off, to go off screen, turn their cameras off and mute themselves. You can also encourage folks, do you see the underneath your screen, there's a bunch of buttons. If you click on the one that has the 3 dots and then scroll down, you can change the layout, but people have to do this on their own. So you might encourage people to hit change layout and then do sidebar. And that way they will be looking at the person who's speaking and everyone else will appear on the side. So that way it doesn't look so crowded with all of the attendees being shown, but off camera, if that makes sense.
Which button is that?
So if you're looking at the one that you're looking at, look at the bottom. So where it says, there it has the mic, the camera, the 4 squares, the share screen, the hand, the attendees, and then the one that has 3 dots.
Okay.
So if you click on the 3 dots one,
Change layout.
Change layout, exactly. So just tell people to go through that, to do that, and so that way they can follow who's speaking and not without distraction for everyone else.
Okay.
I'm gonna check in with the other group.
Okay, thank you, Andrea.
Mm-hmm.
So Edgar, you'll be sharing the slides, is that right?
Yeah.
Okay.
Yeah. And then Donna's video, I have to actually use a file because we couldn't do like you would at YouTube. It wouldn't capture sound. So
yeah, that's always hard. I'm so it's like, yeah, that's always a problem. I'm surprised that nobody's figured that out yet.
Yeah, so it's just gonna see kind of Donna talking as if we like us right now versus our presentation will have slides up.
Okay.
And then you're after Donna's presentation around lessons learned and scaling the work. We didn't come up with a ton of guiding questions in case folks don't have questions, but yeah, we'll work through that.
We'll work through it.
So we'll wait until folks trickle in. I think they're going to start coming in.
And I pass it over to Don, right?
Yes.
Or to the video.
To the video. Put the slide up just so folks know as they trickle in which panel they're at. We'll wait a couple more minutes. I see folks trickling in now. Thanks for joining us.
Hi, everyone. Thanks for your patience. We're giving it a couple more minutes before we start the presentation for folks to log in.
It'd be nice if you have a second to just to drop in your name, your organization or role, perhaps, just to let us know who's in the room so we can better cater the presentation to you. If you have a couple minutes, use the chat function and drop your name, role, and agency. Thank you.
So we're going to go ahead and get started. Welcome, everyone, to the presentation on Promise Neighborhoods. My name is Richard Raya. I'm the Chief Strategy Officer at Meta. Thank you for those of you who have entered your name, role, and organization in the chat box, and let's keep it going. Edgar, if you could advance to the next slide. I would like to introduce your speakers today. I've already introduced myself. I'm joined by my colleagues across the state, Edgar Chavez, the Executive Director of Hayward Promise Neighborhoods at Cal State East Bay, Jose Mireles, Promise Neighborhood Program Manager at SBCS, and Donna Shedrov, the Consulting Director at the Everett Freeman Promise Neighborhood. And you'll learn more about each of those communities in this session. Next slide, Edgar. Thank you. So Promise Neighborhoods were just included in California's budget for the first time this year in the amount of $12 million. And that's going to cover most of the Promise Neighborhoods that are on this call. And we want to share with you, what are Promise Neighborhoods? Why do we think that they're part of the solution when it comes to addressing legacies of inequity in certain neighborhoods in California? And how are they part of an equitable recovery for our state? So Promise Neighborhoods meet intersectional community needs. They are holistic approaches to meeting the needs of communities that have a legacy of inequity, whether it's redlining, income inequality, et cetera. So our work is primarily in low income and BIPOC neighborhoods. And we cultivate community power building to inform systems change, meaning residents that we work with in these neighborhoods are part of the solution. They help us design, shape, implement programming, and they do this in alignment with the city and with the school district and the county, bringing all the systems together around education, health, housing, and more. So it's a whole community approach. And the idea is that over time, these collective impact initiatives will result in economic mobility. And they are a two-generation approach. So they're working with the young people so that they're kinder ready, so that they graduate and go to college, but also working with families to make sure that they have what they need to be economically successful as well. Next slide. So there are 6 Promise Neighborhood communities across the state, from the northern border down to the southern border. So the Yurok tribe is the newest Promise Neighborhood initiative. They are running the newest Promise Neighborhood initiative up in Klamath. And the Paskenta Band of Nomlaki Indians is running the Corning Promise Neighborhood. The Mission District in San Francisco and Hayward and San Diego all work with traditionally working class, low income immigrant BIPOC communities as well. So a little bit of the origin story for these Promise Neighborhoods. They are originally federally funded and based on the Harlem Children's Zone. So Jeffrey Canada of the Harlem Children's Zone had a theory that in his low-income neighborhood, that every kid could go to college if they had supports from Cradle-to-Career to prepare them for college, and their families had those supports as well. And his initiative was successful, and the Obama administration created the Promise Neighborhoods program about a dozen years ago. And so each of our communities has received some of us earlier than others, about $30 million from the federal government over a 5 to 6 year period to jumpstart these very comprehensive community development initiatives centered on children succeeding in school, but also on just having a broader community development approach in alignment with that. The one important note is that the funding for these Promise Neighborhoods federally comes from the Department of Education. Next slide. So to get a sense of the scale of what the community that we're working with about 165,000 family and community members across the state. The majority of those, or the largest group, is the K through 12 students at close to 34,449. We're working directly also with 7,200 0 to 5 year olds and 5,500 college and post-secondary post-high school students. And let me jump to the outcomes of this work. Next slide. So we have seen tremendous results. So the graduation rate in our communities has gone up to about 89% to 100%. In some cases, it's a 21% increase since we've started these initiatives, an increase in the graduation rates. We've also seen age-appropriate functioning in children increase dramatically, in some cases as much as 30% on tests. We're also creating high-quality early learning slots in many of our communities. And if we're not creating them, we're sustaining ones with partners that are already there. Next slide. The other thing that's interesting about Promise Neighborhoods, and I think part of why they're included in the state budget now for the first time ever, is that they were critical to pandemic response. So all of the systems that we built over the past 10 years, some of us have been around for 10 years, all of the systems that we've built, working in schools with families, building relationships, building service delivery systems together, created the trust and the infrastructure needed for distribution of emergency resources. So our cities and counties and school districts relied on us during the height of the pandemic to distribute $50 million in family relief funds, rental relief, utility relief. We also reached out to more than 210,000 community members to help with vaccine outreach, tracing, education, et cetera. And then we distributed 255,000 food boxes and warm meals as well. Next slide. And I will pass it on to my colleague, Edgar.
Thanks, Richard. So a little bit about kind of the theory behind why start at neighborhoods. And we believe that neighborhoods are the unit of change, as we see in research by folks like Mr. Shetty at Harvard, talking about zip codes and census tracts really defining, a child's life expectancy and earnings over time. So as we're thinking of economic mobility and development, his research has even looked at where kids actually are moving up in terms of the socioeconomic ladder. And so it's really at a hyper-local level. And so the theory behind investing locally, but also looking at the ecosystem within which these neighborhoods and census tracts are located is really critical to understanding how to then shift systems over time. And so what we wanted to share today a little bit as we're talking through each of our neighborhoods is looking at paying close attention to what are the assets that we leverage within our immediate neighborhoods. And so that could be housing, education, social services, and health. It's also important to see how these assets vary by, within a suburb, a city, a rural area or tribal community, how different these points of resources are for different neighborhoods and communities. The other piece is the mechanism. So how do we actually move these assets? And so part of the neighborhood model is looking at first a place-based approach, as we've discussed, really believing that the designing solutions from the bottom up in terms of policy is a way to address inequities over time. Second mechanism is through this Cradle-to-Career framework, really believing, as Richard mentioned, this two-generation approach that we're helping the adults around the child over their lifespan, and really believing it starts before birth. And so how the child transitions through each of those systems is critical for this work. The third piece is mechanism is cross-coordination, and that's where we really emphasize the role that, as we leverage our assets, but also how are each of the agencies and systems communicating and coordinating with each other around this final mechanism, which is our outcome. And so because we are this federally funded program, we've been hyper-focused on looking at data, looking at how many we're serving, but not just how many, how well, and who's better off over time, but also looking at then how are these this data informing how we do the work so that we are actually addressing the gaps, equity gaps in these different areas. So I'll kick it off talking a little bit about Hayward Promise Neighborhoods. And so our key piece here is thinking about our civic leadership has been kind of the asset that we've really leveraged in our community. And so Hayward Promise Neighborhoods is situated right within the heart of Hayward, which is south of Oakland. We're a city of about 160,000 people. Our first grant was in the Jackson Triangle. You see outlined in yellow there. That was our first neighborhood. We're now in South Hayward, which is the most densely populated portion of the city, with also the highest percentage, over 80% are low-income Latino residents. And so part of the history of understanding our Promise neighborhood is looking at our historical context. And within Hayward, there's been a history of displacement of entire neighborhoods, Black and brown neighborhoods being displaced for development. And that was the case for Russell City in the late 60s, with many Black families and Latino families, specifically Black families who left the South, came to cities like Hayward and had bought homes and then were eventually displaced. And so that's some historical context, is then how our neighborhoods are starting to become defined. The other part about our history is looking at how transportation infrastructure cuts through and divides our neighborhoods. And for Hayward, that means major highways, two train tracks, major boulevards have really cut up and segregated entire communities, from single family households to highly populated rental neighborhoods. And then the big piece around our community is like the diversity. And so over time, Hayward's become a haven for immigrants, specifically from Latin America and Afghanistan, seeking refuge, and many newcomer students in our schools. And so we operate from really bringing in those voices and those people into the work and leading the work over time. The big opportunity piece for Hayward is that our asset is our educational institutions. At any given day, we have between 40 and 60,000 students educated in Hayward through our K-12 system. We have a community college, and we have a Cal State University East Bay, which is the backbone for this initiative. And so really leveraging, and though we have this asset, these systems did not always communicate with each other, and we still have a lot of equity gaps to fill in terms of ensuring that students from our neighborhoods are actually going to and through college, at least at a local level, over time. During the pandemic, we saw zip codes throughout the Bay Area, and many of us have seen these maps in our own communities. South Hayward was one of the most impacted in the entire Bay Area. And this reflects, again, the working class communities of color hardest hit by COVID. And so our community was certainly leveraged our education institutions to coordinate the support services. Hayward was the first city to make testing free at the onset of the pandemic. Cal State East Bay was the first site where they implemented free testing supports, and our community college became the food hub over time. Prior to that, Hayward Promise neighborhood had the largest food distribution site, and then began to support and expand to other sites during the pandemic. Collectively, we served over 600 families and 2,000 children who received at least one or more services. So one of the key pieces that we did during COVID was repurpose and work with the Department of Education to repurpose funds for projects that we would have traditionally implemented, to ensure that these funds were addressing community needs. So we bought school supplies and infant supplies. Those were high demand for families, making sure kids can learn from home. We actually partnered with local businesses to purchase meals that then they delivered to 100 of our families who were most economically impacted or lost jobs. So we were supporting small businesses and ensuring, especially our elderly, had access to food. We ensured our schools were the first to have Chromebooks and Wi-Fi access, and that became a pilot to then the city creating a citywide tech lending library that's been sustained since then. And of course, helped move rent, mortgage, and economic relief opportunities through our partnerships. Our centerpiece has been around the community power. So during this process, we had a community leadership initiative we had our first cohort right before the pandemic. So we were training local community residents to understand systems and how to access opportunities and become elected officials and run their own agencies. And so as the pandemic entered, these individuals ran for school board to advocate for families. They started nonprofits, for example, Puente Comunitario, in response to COVID, and families in South Hayward who needed access to basic needs. And our Promotora program supported leaders within that program to actually lead families, promotoras, through contact tracing door to door. Our surveys and community input designed our projects, specifically diaper distributions. We were able to fund a bookmobile that went to people when libraries were closed, and began to access food support food hub access throughout Hayward. And so since then, we've really redesigned our framework and guiding principles. And you see listed the many partners that make up this initiative, not just Cal State East Bay. And I'm certainly not the only leader in this. And so you can see a cross sector of city, county, nonprofits, and clinics that coordinate Hayward Promise neighborhoods. And on our framework on the left, we really started to redefine. So as we were talking about basic needs, we were looking at what are the sources of stress for families, and how do we do sources of stress to ensure kids are healthy and thriving over time. We know that poverty impacts health and mental health opportunities, connecting through relationship building and coordination of services, persistence over time and through these kinds of difficult challenges, and this idea of self-actualization, right? Ensuring that families have access to all pathways at any given point in their economic trajectory, all to address these equity gaps over time. So that's Hayward Promise Neighborhood. I'm gonna pass it over to Richard to learn about Mission Promise.
All right, swinging across the bay from Hayward to San Francisco. Mission District is San Francisco's Latino community, traditionally has been the Latino immigrant gateway community. That has begun to change over the past couple of decades, in the sense that we lost 10,000 of our Latino residents to displacement over the past 2 decades. So we've lost 25% of the Latino population. We are no longer the majority. We're nearly half of the Mission District, but we used to be the majority. The Mission District is about 50,000 people squeezed into 1.5 square miles in San Francisco. So it's incredibly dense, incredibly vibrant. And as you can see on one of the images here, Carlos Santana is, of course, from the Mission District. He went to one of our partner high schools, Mission High School. And there's just a legacy of arts, of theater, of street art, murals, lowriders, political activism. And so that's the backdrop to which all this work is happening, and part of the reason why this work has been successful. Next slide, please. So the challenge to this beautiful community is the tremendous income inequality that many of our essential workers are facing. So we work with over 10,000 Mission District or San Francisco residents every year. The vast majority of them make around $25,000 a year as essential workers, working in the hotel industry, in the restaurant industry, as laborers, etc. However, they are competing for housing with high income earners who are working in the tech sector. So folks who are probably making more than $125,000, $150,000 a year are competing for the same apartments that our families are trying to get. So what we have is a huge overcrowding problem with our community, in our Latino community. And here's one of the families that we work with who were part of a Photo Voice project to get the story out about the human impact of income inequality and the housing crisis. And you see here that this family has to live in a garage, and it's not uncommon. In fact, we will see whole families living in one bedroom. There'll be a 3-bedroom apartment with each bedroom having a whole 3 or 4 person family living in each bedroom because of the cost of living, the cost of housing in San Francisco. Next slide. So this is the displacement. This is a visual of the displacement crisis. Folks just getting displaced out of San Francisco into the surrounding East Bay, the suburbs, and even the Central Valley of California. Next slide. So what we did as a Promise neighborhood is we had a collective response to this income inequality. Yes, we are at root, we are an education initiative like all Promise neighborhoods. Our charge is to work with schools and early learning centers to make sure that kids do well in school. But what we heard from the families is that in order for their kids to do well in school, they need to actually have a stable place to live in San Francisco. So they are not displaced. what you see here is a visual of our neighborhood, the Mission District, outlined in orange. And you see all of the partners that came together to form our Promise neighborhood. So it's 15 different partners. There are early learning centers, health clinics, legal rights providers, tenants' rights providers, and more, mental health services providers. We are meeting families at the schools where they are and connecting them to wraparound supports. So we work in partnership with school principals to make sure that kids and their families get wraparound supports, and also that they get the academic enrichment that will prepare them to eventually go to college and start a career. What's powerful about this work is that it has all of us coming together around a common agenda. So CBOs, the school district, the city, a common agenda, some shared measurements that we can align ourselves to, and just constant communication to make sure that we're working together collaboratively. My organization, the Mission Economic Development Agency, is the backbone agency coordinating all of this work, collecting the data, sharing the data, et cetera. The one icon I'd like you to notice on this map is the schoolhouses. There are black schoolhouses and orange schoolhouses. There are a total of 9 schools that we're working with in our neighborhood. The color difference only denotes that some are newer partners than others. But this just shows the collective place-based response. Next slide. So what we also did is we became an affordable housing developer because housing was such an issue. And this was as a result of residents organizing. That's a big part of Promise neighborhood work, is listening to resident voice. And the residents organized and pressured the city to create affordable housing programs for lower income families in the city. And so you'll see that we have now preserved or produced about 1,400 units of affordable housing. Again, in that map, in that neighborhood footprint, as you can see, with that sort of blue or turquoise outline. Next slide. This is an example of one of the newer housing developments that we've produced, and our partners that I mentioned earlier are often located in the ground floor retail spaces of these buildings, and our families are living up top. So our partners, like our early learning centers, are on the bottom, or other family serving agencies are on the bottom floor, and then the families that we will work with are in the actual apartments. Next slide, and that's a before and after picture there. So the results: we've served 12,000. We serve 12,000 families annually. We've helped them fill out $5 million in annual tax returns. You already know about the affordable housing units. We saw the medical home rate go up from 61% to 80% through our partnership with our community clinic, and just connecting and referring families to that clinic as part of our Cradle-to-Career wraparound supports. The kinder readiness rate has gone up from 47% to 71%. And our graduation rate has gone up from 68% to 86%. And I believe that's it for my slide. The last thing I'll say, I'm sorry, next, one more slide for us. So the interesting thing about COVID, and this is not unique to our neighborhood, but we seemed to be hit the hardest when COVID hit. So even though Latinos were only 15% of San Francisco's population, they were 50% of the positive cases at the beginning of the pandemic. And of course, we attribute that to the fact that they were forced to live in overcrowded conditions because of the housing crisis and the income inequality. So they couldn't isolate when they were sick. And then, of course, many of them had jobs that they couldn't do by Zoom. They had to actually go into work to do the work because they were frontline essential workers. So they were getting a constant exposure to the virus. As mentioned at the beginning of this session, the city and county of San Francisco reached out to us to do vaccine outreach. We reached out to 11,800 residents. They also reached out to us to distribute income relief in the amount of $8 million to 6,000 families, and then $10 million in loans to 350 small businesses, and also lastly 1,650 rental relief applications. So with that, I will pass it to my colleague, Jose Mireles, down in Southern California.
All right, thank you, Richard. So yeah, bringing it over to the Southern California over here in Chula Vista and San Diego. So we represent SPCS Corporation. We are the backbone organization for both Chula Vista and San Diego Promise neighborhoods. And basically, just a real quick, overview of SPCS. We've been in the community for about 50 years now, and we provide multiple services. We're a multi-service organization. We do shelter services, counseling, school programming. I mean, anything. We've been really responsive over the past 50 years to address the needs of the community. So, coming into the Promise neighborhood world was a really good fit for the work that we've been doing for those many years. But here, the graphic that you have here, it's a representation of the Promise neighborhood Cradle-to-Career model, where we have our families and community navigate through from as early as when there's a newborn in the home, all the way to when youth is going to college and career. And in between, we have all these set of strategies and partners coming together under these under this banner to provide the support to the community. Now, like mentioned earlier, the origins of the model was really based more on sort of like that academic outcomes and building that capacity for underserved communities. And while we knew kind of that infrastructure was there to create that alignment within these systems, during the pandemic is where we saw this model really demonstrate its potential for providing the infrastructure to bring the partnerships together and the system together under the common set of priorities, and how not only that, but also how can it easily adapt to the needs of the communities within a short time frame. So we saw a lot of that during at the onset of the pandemic. And just to share, some of our experiences, during COVID, we were able to transition a lot of our community engagement strategies, specifically promotoras and resident leaders. We were able to engage them and have them be part of the efforts to support health and basic needs in the community. So some of the examples, we had our promotoras. They were also doing, like, in our other communities here. They provided contact tracing, community education, vaccine outreach, and we were working very closely with our county's health department to ensure that all the information and all the work that was happening was in alignment with what they were looking to achieve in the community. So always making sure that we had that consistent source of information for the community and reliable, being a reliable source. But also, we were able to bring together local governments and community-based organizations to braid a lot of those resources together to modify programs and address some of those basic needs that we saw during the pandemic, food, housing stability. And even as of this date right now, we have a lot of our promotoras working very closely right now with academic institutions to learn about, how can we implement strategies so that we can provide more access to healthy foods in the community. And just one example, one recent success that we had, we through the promotoras, we were able to enroll over 1,000 households in the CalFresh program in one of our partner schools. And because of that effort, the school was able to reach a certain threshold to qualify for the low-income status or for the free and reduced lunch. So it was something that the school was looking for, and through this effort, we were able to provide that support. But also, a lot of the other things that we saw during the pandemic, with the districts, we were able to address a lot of those technological gaps. A lot of families lacking the Wi-Fi or the devices to access distance learning. So, a lot of our families, not having the resources to do that, through Promise Neighborhood, we rallied a lot of the different programs and strategies to come in and address that gap. And even in the mental health aspect of the pandemic, a lot of our families were struggling at home, not being socially isolated. So through the promotoras, they also tackled that by creating community groups, virtual groups, where people could come together through that peer-to-peer support. But even creating those spaces where community leaders can come in and connect directly with the community and share the latest information. So keeping that consistency and that connection with the community was one of those key strategies also that we did during the pandemic. And as a result of that, we saw reducing a lot of those hospitalization rates in our community just like Richard mentioned in their community, like for us, we're a majority Latino population. So we represent about 60% of the community, and yet we had the highest infections rates within the entire county, and that, the 60% was just for our particular neighborhood, but overall in the county we were about 30%, but we still represent a much higher rate of that in infection rates in countywide. But also, in addition to that, we were able to serve families with food, and we managed to serve about a little over 250,000 individuals with food services, and distributing over about 32 million in rental and utility assistance. So a lot of those resources would not have been possible had not been like this, sort of this model where we have all these different programs and systems coming together. But one very unique experience that we had, as it also relates to, how this model kind of comes into play. We had through Operation Artemis. So back in March of 2021, we were approached by the county and to discuss the needs of all the thousands of unaccompanied migrant children that were coming to the border. So our charge was to bring together a group of community-based organizations and in a matter of weeks create sort of this infrastructure to receive all the thousands of children and provide the care and the resources to transition them into homes. So, we took the lessons from this model and we then organized these systems of care for these children. And in a matter of weeks, we built this village, at the San Diego Convention Center, where we provided the food, shelter, education, recreation, and immigration services. So over the course of that time, we were able to serve over 3,200 children, and we were able to reunite 2,400 of those to the children to relatives or sponsors. Next slide, please. And so just, what we learned about the implementing of the model is that it takes the relationships and the systems alignment to meet some of those most difficult challenges in the community. You can have great programs and strategies, but, the value of these programs just grows exponentially when you're able to build these effective relationships with government, with education, all these different, sectors in the community under, common set of priorities. Also, of course, it takes, the leadership of a backbone organization and with that knowledge and experience to come in and bring those partnerships together under those results. And of course, the residents, you can't leave the residents without this, so they were, collectively, with us, jointly building a lot of this kind of this infrastructure into place. So, again, relationships are a critical factor. Also data, we were very, very data driven, and always having those dialogues, those courageous conversations, with, partners to ensure that, we're all aligned in the same direction, and, utilizing the best available knowledge and resources and data to get us to the right place. And this is just a quick snapshot on some of that Operation Artemis work that I just mentioned, some of the survey results, from the youth that we served. But overall, it was just, an incredible experience, being able to serve all the children. But even, the other great experience is seeing like how this infrastructure was replicated in this situation so that we can then serve these children in a very short time span. And I think that's my last slide. So with that, I'll pass it over to Donna. Thank you.
Thank you, Jose. So Donna, unfortunately, can't be with us today, but we have a recording. And so what Donna works throughout rural California, and so she's typically on the road or training, but just wanted to highlight a few of her points here. But we're going to share a bit of her video, and I think it's important to capture a little bit about what are the unique challenges in rural and tribal communities, and how this model has been incorporated in those spaces. So give me a second, I have to put a video on.
Hi, my name is Donna Shidra. I apologize I can't be there in person with you today, but I wanted to share a little bit about our community. So between 2017 through 2022, this year, the Paskenta Band of Nomalaki Indians engaged in a place-based initiative concentrating federal Promised Neighborhood funds in a community in Northern California. significant resources were poured into that community to improve education, also development outcomes. And it was across the Cradle-to-Career continuum where solutions were implemented. In early learning, that meant in supporting home-based educational and also health programs, working with multiple stakeholders to improve outcomes in center-based programs, moving into this center of excellence. That also includes building the professional capacity of the pre-K educators, and also strengthening the vertical and also horizontal connections within the community, such as private preschool, working with state preschool, along with early Head Start. The tribe also invested resources in school districts to build educators' capacity to improve outcomes in core content areas. That includes also ELA, that includes math, that includes reading. They also supported other areas that includes EL learners, dual enrollment, which was offered for several years at no cost to the students. Their work also expanded out to an adolescent diversion program. That over time was scaled to a county level. Their support also included a recreation and enrichment program through the city of Corning. About a year ago, the city, who partnered with the tribe on this, were able to procure millions of dollars and now are able to build a recreation program within the community that's going to be up and running in about 2 years. One that is important to me to highlight, one thing that's important is that all of these, majority of these efforts were sustained by the partnering organizations. So that kind of gives you a quick overview of the strategies. There's one I have not mentioned, but I want to touch on that one because it's creating a healthier community, also contributing to economic security. So as we're all aware, living in low-income households has been linked to poor health and increased risk for mental health problems that can continue throughout the lifespan. Yet, while there's a greater need, for families who are living in poverty, they are the least likely to be connected to those services. And also research shows that when the mental health is left unaddressed or untreated, it affects the well-being of not only the child, the family, it can affect the entire community. It negatively affects a child's ability to learn in school and many other areas, including gain employment later on in life. If these issues are addressed early on, which was our goal, there's going to be positive spillovers that benefit the entire community. And so knowing this, knowing that real change cannot take place without addressing mental health and recognizing the consequence of it being left untreated, the emotional costs, economic ramifications, the tribe leveraged the community's assets to implement an effective strategy. Namely, they partnered with multiple organizations to offer therapy services offered by licensed marriage family therapists at no cost to any students attending K through 12 schools. That was expanded to also include pre-K children in select center-based programs. I want to share the significance of the strategy, shedding light on the challenges to the provisions of mental health services in rural communities. The challenges can be distilled down to accessibility, availability, and also affordability. Let me start by painting a picture for you. In rural communities, with the community I work with being no exception, there's no public transportation. Therefore, there's a reliance on the family to travel longer distances in order to access any type of services. And then in this community, with our community, there was a large number of families living in poverty. They don't have access to resources really to cover the cost of mental health services, let alone to pay for gas to get there. And even if affordability was not an issue, there's a chronic shortage of mental health providers, and it affects rural communities more so than urban communities. So imagine this, the mental health crisis was all too common before the pandemic, when the pandemic hit, across the nation, the need was magnified, even as or simultaneously there was access to services was diminished. We are very fortunate in our community because we have leveraged that resource or that community asset of working together to implement the strategy. And all we were doing was really continuation of services when the pandemic hit. The work didn't stop there also. In 2021, the tribe convened leaders from cross-sector organizations, 25 leaders extending across the county to begin strategizing, identifying ways to accelerate community health, to cover the entire cradle-to-career population. In a rural community, in our rural community, leaders know the complex needs of families and that it cannot be addressed with a single direct service approach, but it requires system level strategizing. So from this, collaborative thinking emerged the need to begin implementing a trauma-informed resilient space practices in early childhood classrooms, and also to grow the capacity of individuals across the county. That includes parents and practitioners from different sectors. That could be CPS, that could be therapists within their own practice. So really it takes a village approach where the mechanism of cross-sector collaboration is reshaping what is possible in communities across California, including our community in the Corning Rancho Tehama community. So thank you again. My information is going to be available at the end of the PowerPoint slides. Have a wonderful day.
That was Donna. Thank you. Yeah, that was Donna just reiterating those points around the challenges for rural communities, specifically how tribes can support and how Promise Neighborhoods were a catalyst for collaboration. So we have 2 more slides for you, and I'm going to get you, Richard, back on to close us off here of some lessons learned and how we're scaling the work. Give me 1 second. Go.
All right, so second to last slide here. What are some lessons that we've learned from this work over the past decade? Strengthening the existing civic infrastructure, so meaning the relationships between community-based organizations and government systems and the school district, et cetera, is crucial to sustaining and providing rapid responses. As we saw with the pandemic. We've also learned that flexibility in program implementation and the use of resources tailored to community need is the way to go. Each community is different. Each community has its own particular needs. So Promise Neighborhood investments do not prescribe exactly how you spend the dollars. They do hold you accountable to some results that your community all agrees to try to reach. But in terms of the actual programming to get there, that's on your community and its specific needs and strengths to develop. And it's worked amazingly well. And then trust in networks allows us to be nimble and pivot quickly. Again, as we saw with the pandemic, having our community come together and align around outreach and emergency resource distribution systems, using our promotores and community health workers to get the message out around emergency response. All that relies on trust. And in fact, that's why the city and county reached out to all of us, because we have built the trust with the community and the families that were most vulnerable, because we've been working with them from cradle to career over the past few years. So we are the trusted messenger. And so that's essential. And I think that's the last slide. Sustaining impact. So it's important to note that these Promise Neighborhood grants are not forever. They last 5 years. Again, they're $30 million from the federal government. After that 5 years, every community faces something of a fiscal cliff in terms of just figuring out how do we maintain our level of services, our level of collaboration without that federal money. So in many cases, we have to braid local funding with private funding. So we'll have community foundations or national funders come in and partner with the city or the county to help help us figure out a way to keep this very important work going, this very important collaboration going. And so with regard to the state, we are also approaching the state to help us institutionalize this work, because in many cases, the state relied on us for emergency response. And also we're just helping the state meet its goals around education and economic mobility. So all of the 6 Promise Neighborhood communities in California have formed a network, the California Promise Neighborhood Network. So we are a learning cohort together, and we also advocate together for systems change. We are working very closely with Strive Together and Grace and Child Poverty California, 2 organizations that I'm sure many of you are familiar with. They are our close partners in this statewide advocacy work. We did have a bill called the It Takes a Village Act, AB 2517, which made it very far along in the legislative process. And although we did not get everything that we wanted to get in that bill, we did get $12 million for some of the existing Promise neighborhoods to stay in operation and to kind of meet the needs of their communities, and so that they don't go away as the federal money goes away. So it's a big thing that the state is investing in Promise neighborhoods. We're thrilled that the governor approved this funding, and we're going to continue to work for more. And we think there should be more Promise neighborhoods across the state. And then lastly, federally, we are working with the Harlem Children's Zone, Strive Together, and PolicyLink to ask the federal government to increase the number of Promise neighborhoods in the country. Right now, the budget for Promise neighborhoods nationally is about 100 million. We're asking them to increase that to 500 million, just based on the tremendous amount of unmet need out there. So many communities have applied for Promise neighborhood grants, but are unable to get them because the pot is so small. Yet these communities, like ours, are ready to collaborate, ready to create systems. They just need that initial jumpstart investment. And so we're advocating on all these levels to keep our work going, and to also just scale it so that we are not boutique projects, so that we become the normal way that government works, because we think this is good government. It's collaborative, it's community driven, it's accountable to results. So that's why we're in this fight. We believe this is the future of government. And with that, I will wrap it up. And if there are any questions, we're available to answer some questions.
Thanks, Richard. And as our bill says, it takes a village, and also we're here to, when we say we in terms of Promise neighborhoods, is leveraging the state investment to build the kind of the template, the foundation for the state to continue operating their own Promise neighborhood programs. There's one point we're really clear about is how do we support many other communities across the state that are doing collective impact cradle-to-career place-based work already, and elevating those communities to access some funding in the future. So wanted to add that. But that concludes our presentation. We want to give some time for questions or comments, anything. If you want to share any work that you're doing around this, or you've seen other projects that perhaps are not Promise neighborhoods that you're part of that are doing similar work.
If there are no questions, I just want to thank my colleagues, Jose and Edgar, for helping to put this presentation together. It looks like we do have one quick question in the chat. Are you able to share more about Meta's City Promise announcement? Yes. So in October, we did launch the Promise City Initiative. And what we're saying it collectively is what the infrastructure that we've built in our neighborhood, the Mission District, should not be limited to the only neighborhood in San Francisco that has this type of collaborative infrastructure. And so the city is partnering with us to create Promise neighborhoods in 3 other neighborhoods within San Francisco. 3 other neighborhoods that have been redlined, that are historically communities of color, working class, low income, immigrant, BIPOC, communities of color. And we're doing this in partnership with the mayor as part of her recovery plan. So once we get that up and running, we're in the planning process now in these 3 new neighborhoods, where our goal is to have 4 Promise neighborhoods in San Francisco, all 4 aligned to the city's equitable recovery strategy. But we're super excited about that because we see that as over time, it will be systems change. It will be institutional change. It'll change the way that the city works with communities, and it'll change the way that communities work, within themselves and with the school district, et cetera, just a more collaborative, outcomes-driven approach in the highest need communities. And it also means a lot more investment in those communities. Thank you for your question. And if there are no other questions, again, just want to thank Jose, Edgar, and Donna for helping to put this together. This was our first time presenting, I think, together as a group. I think we're all used to presenting individually for our own Promise neighborhoods. So it was great for us to do this first time ever joint presentation. And, I'm looking forward to doing more with you all. So thank you, Edgar and Jose and Donna.
Likewise, Richard, and all the participants, thank you. Jose, go for it.
I just say thank you, Richard. Thank you, Edgar. It's a pleasure to share the space with you and be able to share our experiences with this effort. Thank you.
All right. Well, have a good afternoon, everyone.
Give you some time back.
Yes. Bye-bye.